Welcome to the Live Fully with Kratom podcast. I'm ETHA co-founder Alexander Karp, and today we have a special guest, author, Kratom enthusiast, Eric Platt. Good morning, sir.
Good morning.
Well, today we are going to start and get going about all of your findings, informations, and what you've discovered and questions you have about Kratom. Let's get started.
All right, so the first question is, what is the proper pronunciation of Kratom?
That is a good question. And I would say this always comes into language in general has many pronunciations, and generally etymologists, people who study language, study words, can often determine where maybe somebody grew up in certain regions of the United States. And I've heard based on like crayon is a famous word that can be pronounced crown, crayon. So there's all sorts of pronunciations. And Kratom is kind of the same way, where different countries or different regions, different places across the world pronounce Kratom differently. So
Right.
I've heard Kratom, Kratom. Have you heard any other?
So I'm good no matter how I pronounce
Absolutely,
it.
yeah. You are 100% okay no matter what way
Everybody's
you pronounce it.
confused here.
Exactly.
I imagine, though, maybe where it originated and the word Kratom originated, they had their own present. Not that it matters, but
Yeah, I
I
mean,
was just curious.
because I've also heard in Thailand, I think they actually call it like bak. So it's even completely different pronunciation or a word than we would even associate to Kratom or Kratom. So most of the time when I travel to Indonesia or Thailand, the locals are not familiar with the word Kratom or Kratom. So I think that's why it's a word that doesn't necessarily have a correct pronunciation.
It must have come from somewhere, though.
Yeah, I actually don't know the origins of where it came from, but yeah, it's a good question.
Yeah. Okay. Something for my book.
Yeah, I mean, I am actually traveling to Thailand in a couple days tomorrow. So if I'll get some more information and ask specifically. And if I come across anything, I will send it your way.
All right.
All right, and then next on our list, we had a question from Eric regarding the COAs on our website. Eric, if you want to ask that question to Alex.
Yeah, sure. So when I got some samples of the various, the little Kratom pills you make, the compressed powder, and so I was, in my thoroughness of my research, I went and looked up every certificate of analysis, and it kept coming up with it, didn't find it, so I emailed your support, and then they replaced them. They said our IT department put them up. I went and looked at them, and they all came up as the same sample, the same PDF. So then I was asking, what distinguishes these? Are they physically the same? Why are they all the same? COA is the basic question.
I think you're probably talking about our small sample packs.
Yeah, all the daytime ones.
Right.
It was only the nighttime that was different.
Got it. Yes. So the sample packs, we have basically a serialized number. And so part of that IT issue was that we've been implementing this system to track each individual package. And so that was part of the IT issue of why we probably had an error that was not coming up at first. But that's an ever-going process that we keep improving. So that's kind of the reason it wasn't to begin with.
It's a lot of work, yeah.
Yeah. And track and traceability is a very complicated topic, no matter what industry we're talking about. I mean, it's very famous that pharmaceuticals have to be traceable down to the package level, the consumer side. And this was implemented in November of 2023, I believe was the mandate. So it's very recent. So they've had traceability for a lot of their products, but even pharmaceuticals implementing to that package level is still in an ever increasing kind of way to bring transparency to a lot of these industries.
You're kind of thinking that as a sort of guideline for what you want to ideally implement.
Yes. And so, because my background of engineering, I am also implementing a track and traceable system called HyperOps that I'm really trying to be able to implement from the harvest side. So can we go to the jungles of Indonesia, Thailand, get those locations of where items are harvested and track that all the way to a package level of consumer.
Wow. Okay.
And so it's a very interesting problem to solve. And I have a great colleague, Greg Matula, who has years of experience doing RFID technology from Hewlett Packard for their global supply chain. So that's where a lot of this experience comes from, and how we're trying to create a system that we just haven't found out there yet.
Mm-hmm.
But I think back to your question of why do some of our products have the same COAs? And that's because our premium blends of Kratom, so sunrise, sunset, midday, are blends of Kratom to try and create a consistent alkaloid profile. And what we do is when we have a certain batch of several, white, green, or white vein, kind of that stereotypical different alkaloid profiles, whether it's for energy, muscle relaxation, that spectrum of benefits. When we get those large lots in and we test them, then we blend those varieties to make those premium blends. And it's because we get that one lot or those several lots together and make several products of the premium blends, that's why we end up having the same certificate of analysis for the, say, master lot of what is used in the blend. And then we don't quite give away, say, our proprietary recipe of how we blend it, but trying to still be as transparent as we can.
That's what I was wondering. Yeah, I was thinking maybe, well, you've got a proprietary blend here, so you don't want to give away all your secrets, and yet you want to reveal what's in it. And probably most people are not going to dig as deep as I do.
Yeah. Yes. And
I was going to go and look at each COA and do a spreadsheet, because I'm that kind of nerdy person, see what the difference, because I'm curious, what is the real difference between different
and that's
products?
and right now we standardize more around mitragynine as the main indicator. And then the secondary alkaloids, we have indications or kind of hypotheses of what we think, like painanthine being more of a muscle relaxant. And so we don't have a true, say, specific recipe to every single alkaloid, because we're kind of, even science itself is understanding more of the complications of how the secondary alkaloids have this synergistic effect and interact. And I think that's why there's still this, we're directionality, trying to give as much information as we can, but then also as we learn more, the Kratom industry in general is trying to uncover what alkaloids are providing those benefits.
That led into one of my other questions. I don't know if you want me to go into it.
Yeah, absolutely.
But I mean, it seems like it's still quite a bit of an unknown or mystery about exactly what the different alkaloids do.
Yes.
And so you're kind of just, it's more of an art at this point, I guess. It's not an exact science. You don't know exactly how to create a specific effect. You just sort of try. I mean, that's the question, is how do you test to know? It's pretty subjective. I notice even the same batch, a different day, the subjective effect will be very different depending on your body state, your state of mind, and so many different things. And there's how can you even pin down exactly? But at some point, I guess there will be more of a science if you test each alkaloid or combine them. But it sounds like it's quite a long road.
Yeah, and I think we see that across, to your point, kind of, the science is not really settled. And in my view, science never is settled. There's
That's
always
true.
more understanding. I mean, I remember when I was younger learning that, atoms and particles is what make up all of our reality and existence. But then if we start understanding deeper, understanding that quantum mechanics says that that's not really true, it's all vibration. So we kind of keep peeling back these onions,
Yeah, right.
and ever increasing.
And then even there is different interpretations.
Right.
Of
Yep. Yes.
So,
But I think, back to the Kratom and the benefits, perceived benefits and differences, there's the complications of, because it is a natural compound with many, many alkaloids. And Dr. Chris McCurdy talks about, I love his analogy calling Kratom a symphony of alkaloids. And if you just have one instrument that, you listen to or turn up that effect, you get one benefit out of it. But when you have multiples combining together, then you get this orchestra of music that kind of really plays well together.
absolutely. That's one of the reasons I prefer, I make my own tea, because nothing against your product, but when I tried the first time I tried an extract, actually, I tried your pill,
Oh yeah, yeah.
and it just didn't have the full. I mean, maybe it's because I'm so tolerant, but it didn't have the full feeling of like my tea, So
Yeah, I mean, I would say, I get different effects out of our products as well. So I would say that example, like our extract mint products that are more of a bias or isolate towards mitragynine, those to me give me a much more energizing effect typically versus the full, well-rounded full benefits of, say, a kratom tea or the whole leaf tablets. I mean, for me, I still prefer the whole leaf tablets as my preferred kratom consumption more so than any other product, because it is that natural form of the plant material, has all the benefits. It's very subtle. It kind of, really complements my life, where sometimes if I take extract, it's a little bit, I can even sometimes overconsume it, and it just has a little bit different feeling for me. And also, to your point, there's also the individual aspects of our body, how we metabolize foods and other compounds, that then, something I can consume is going to have a different effect on me than other people. And we kind of know that.
Absolutely, yeah. It's again, that's why it's so difficult to pin down any sort of direct one-to-one effect from a cause with Kratom.
Yeah.
But there are some patterns, it seems like, and it's one of the reasons I like tea. I mean, maybe we can talk about that.
Yeah.
But to me, it feels like the effect comes on faster with the tea, and because it makes sense that you're not digesting a leaf like if you drink a powder.
Mm-hmm.
So what is your impression? It seems like a tea has a different kind of effect and a different speed to you.
Yes, I would. I think there could be two reasons for that. I think one is, I guess what is in your tea, or how do you make it, if you don't mind sharing?
Oh, absolutely. It's just, it's very similar, it turns out, to your, what is this, Refresh. I was just reading the ingredients. I used crushed leaf and actually have a laboratory stir that I had left over from another project. So I just put in a batch of like 20 grams of tea, 1,500 liters of water, and stir it with 10 grams of powdered or lime powder, similar to how you use
Citric acid.
lemon powder, and stir that for an hour. So it's just crushed leaf tea with an acid to help the solution, because I happened to run across a reference that said that the alkaloids in Kratom are much more soluble at the low pH. In other words, acidic, like pH 2 or 3 or something. And it seems like that's true. It extracts a lot more of the alkaloids in an acidic solution, and also the lime helps the flavor a lot too. It can be a little bit bitter, as you know.
Yeah.
I don't mind the flavor, but it helps take the edge off.
Yes.
And then I sweeten it.
Excellent. Okay. Yeah. It's very similar to our Refresh tea. And
sounds like it.
Yeah. And to your point, an acid definitely is a better soluble solution than just water or even other solvents. So when we were early on in our testing, working with laboratories to make kind of a consistent lab test, we found that some laboratories were only using methanol or even aqueous methanol as their sample prep.
That doesn't sound good.
Well, it's like
I guess it's standard, but
yeah, and it's okay for a lab, because it's really, you're only using that for the lab test, creating a sample extract, putting in HPLC, and then it's only to get the alkaloid profile. It's not being consumed or that side. But what we did find is that some laboratories, their method, which is their sample procedure of how they test the product, they were using just methanol or aqueous methanol, and we weren't getting consistent results out of it. And we did then work with them to change their method to include an acid, hydrochloric acid, that created a consistent 100% extract to give us that better data and more consistent data. So acids absolutely are a better way to extract the alkaloids.
Yeah, I was very fortunate that I ran across that. I probably saved myself a lot of money too.
Yes. I think Victor and I actually did a tea test probably about 7 years ago. We were, making kratom tea, and we kind of heard of a similar, I don't know, maybe Reddit or online article that people would use lemon juice and it was a better effect. And we did a test where we made kratom tea, which is hot water, boiling the water with kratom leaf, and then we used lemon juice, the kratom tea or the kratom powder, and a little bit of water, and we sent that out to a laboratory test and found that absolutely that lemon juice helped extract probably about quite a bit more from what I remember. I want to say it was maybe like 40% of the alkaloids with water alone were only extracted, where about 70% of the alkaloids were extracted with lemon juice and water. So it's a much more effective way of making tea.
So that brings up one of the things that kind of motivated me to start the website and start researching and writing is all the myths out there about kratom. And one of them I see on the web sometimes is about, what's the name? They talk about using a, something like grapefruit juice or whatever to enhance.
Like a potentiator?
Yeah, potentiator.
Yes.
And I could be wrong, but it seems to me that it's not really a potentiator. It's just dissolving it more, right?
So grapefruit juice specifically is...
Oh, it's different.
Yes, because white grapefruit juice and white grapefruit extract, it inhibits an enzyme in the body that breaks down a lot of compounds, including most medications and drugs. So the mitragynine is processed in the liver through the PY450 enzyme. So that's why if you have white grapefruit juice that inhibits or stops that enzyme, then the mitragynine and other alkaloids will essentially last longer in your system. So it's not really going to increase like the effects, but it will stop your body from breaking it down as fast or as quickly.
Oh, I see. Okay, interesting.
Yeah. And then so, I think back to your comment about tea being maybe a more quick effect. So I think part of that is that as if I'm drinking tea, I'm getting it in my mouth and where there's like a smaller or thinner layers of skin. So famously there's kind of something called a sublingual. Yeah. So I think some of those alkaloids go directly into the mouth as soon. Yes.
Oh, interesting. I was wondering about that.
Yep.
Yeah.
I've also read or done some in that
Let's
salt
try
based.
it right now. We'll experiment. Is this sweetened? Is it purified water?
We do have a natural sweetener in there, but just a very small amount. So it's less than 5 calories per bottle. So it's a very low calorie natural sweetener that we use.
Okay. Yeah, mine is a lot sweeter, but I understand a lot of people don't want that. So
yeah, we're always kind of understanding flavor profiles and trying to understand what people are looking for.
Yeah, it sounds like you've come up with a lot of different products.
I think that's really what we're good at doing, is that self-experimentation, and then really that curiosity kind of drives a lot of development that we like to do. And just like you, that was, we learned about kratom and then had a great profound benefit in our life. But then also there was kind of this variability of sometimes I would get kratom and it didn't work. So, okay, was it the kratom that's different? Was it my body that's changing? And then that kind of evermore that rabbit hole of going down to why are the effects different? And
plus the fact that it's changed a lot in like 2010 or something when I first encountered kratom. It's very different back then, and I stopped using it for 10 or 13 years. Wow. And then it's totally changed. Wow. It's become like this professional field, not dark corners of the internet where you buy it.
Yeah, I would love to hear your story about how you first heard about kratom. And so you said in 2010 was your first time.
I'd have to look back on my website on my story because I don't remember the dates offhand, but something like that, 2010, 2013. And it was actually a friend I met through a church I was going to at the time in San Diego, and he's a social worker, and he was like amateur ethnobotanist and psychopharmacologist.
Yeah.
He was trying all these different herbs, and I think at the time I was kind of struggling like with some anxiety and moods and so forth, and he said, "Oh, you should try this kratom," and I found some vendor on the internet, or he gave me a sample, and yeah, first time I tried it, I thought, wow, this is great, very uplifting. I felt wonderful. So it got me enthusiastic about it, but back then you just didn't know what you're getting, and it all, like I said, it's some kind of anonymous vendor on the internet. They make up some name, and sometimes the effect feel kind of like, nerve-wracking, or maybe because I too much caffeine, or who knows, that's the thing.
Yeah.
You don't know what's going on. And so I just kind of felt like it was too stimulating often, and I didn't know what, is this a good thing to even do? So I just kind of said, okay, I'm stopping this totally. Okay. And I got involved with a spiritual group, and none of those people had any knowledge of it, and it just seemed like something that didn't sync with that. So but fast forward, ironically, it was the same or the satsang, these meditation groups around the same teacher. I met this guy who liked Kratom also, and I said, well, and I asked where he got it, and I found out, and I tried it, and it was like, wow, this is like really good and different from 10 years ago or whatever. So it seemed like maybe the quality had improved, and also the whole field, become much more professional and businesslike, and it made me feel a little bit better about this is something that would be helpful, and that absolutely. I could trust a little bit better. And then so I started doing this research because I found out, oh my gosh, things like white vein and green vein and so forth. A company in Colorado called Tea Tree is making tea bags, and they have articles on there. They're saying about the myth of these different strains, and according to them, it's just like how it's processed after it's harvested. It's not actually a strain of red or green or white trees. It's like the red vein is the farmers put it in burlap bags and let it ferment a little, and it turns reddish. Yeah. So I don't know if it really doesn't correspond. And this is like my experience before. Sometimes the same thing will have a very different experience. So it's like, what is what here? Is it really red vein is more sedating, or pain or anxiety? Who knows?
Yeah. So from my experience, actually both are true. So there are kratom trees that have primarily, say, green leaves or green veins, and just a bright green. And then you have other kratom trees that have green, but then some of the veins are reddish color, or some of the leaves will kind of get a little red tinge to them, just growing on the tree naturally.
So a different genetic.
Yes, there are definitely different. However, to your point, most of the practices in the industry, vendors will just take any kratom leaf, put it in a plastic bag or in a plastic tote, and let it ferment for a couple days, which really the chlorophyll kind of breaks down, and it's kind of like fall leaves turn to that reddish color. So that is kind of the complication.
Vendors here on the
in
the
Indonesia.
State side, in Indonesia.
Yeah, before they dry it. So they'll typically
like
pick the leaf.
Whole leaf.
Yeah, they'll pick the leaf, put it in a bag for anywhere from like 1 to 3 days is the most common. Get it a little bit reddish color, then dry the leaf, make a powder out of it. So that's the complicated part, is that a lot of times, a lot of these, a lot of the answers are yes, both are true, but it's just that, it convolutes the information, because to your point, most of the kratom that is purchased, if I'm a consumer and I go to a website to buy kratom, it is going to be a red, color to it, but the alkaloid profile, it's not like, farmers actually picked only the red veins. So it's hard for us to get some of this true information.
And sometimes it's not even reddish. I mean, I've noticed a lot of times the powder, they all look identical. It's just the packaging is different. You have no way. Yeah. But that's why the certificate of analysis is important, assuming it's accurate. Yeah.
Yes, exactly. Yeah, that's the other complicated side in general, is how to get more information, get a better certificate of analysis. I mean, early on when we were using laboratories, even the lab space has changed dramatically in the last 8 years. When we first started testing kratom, there was only, say, a couple labs that had a method for testing the alkaloids. And at that time, they would only test for mitragynine and 7-hydroxymitragynine. But we know that speciogenine, speciocialatin, and painanthine, those are actually isomers of mitragynine, so the same molecule but a different shape. So yes, and labs now do test for more of the alkaloids, which is kind of giving us more of that indication of which alkaloid profiles correlate to what benefits consumers are looking for.
Okay, interesting. I didn't know it had changed over time. It sounds like it's gotten more sophisticated, and they're addressing the what the companies need for their testing.
Yeah, yep. I mean, yeah, and analytical testing in general is a very complicated topic that, I mean, I was fortunate enough to work at Hewlett Packard. And so Hewlett Packard, they invented a lot of these analytical instruments before they spun off Agilent. So Agilent is a very famous instrumentation company. A lot of labs purchase their equipment to do this kind of testing. And so I got some really deep knowledge when I was at HP working at how to build these systems from scratch, from the ground up. And it involves, I mean, for me, it was kind of overwhelming. I had a lot of great resources at HP, but even just the statistical analysis, how do you know that you're measuring something meaningful versus random noise, is a big area of development that's an ongoing development for us.
Yeah, it seems like ETHA, your company is unique in that you're trying to combine like the science with the marketing rather than like, let's just see what we can sell.
Yes, absolutely.
As much as possible. And that's, it's difficult, but I think it's kind of unique.
Yeah, I think personally my passion is around how do we take the best of what pharmaceutical companies have developed over the last many decades around testing, understanding individual molecules, and how do we apply that back to natural compounds and essentially, merge the best of modern day science and analytics, but then apply that and really appreciate nature and the complexities and try to get the best of both worlds.
Mm-hmm. Let's see. Do you mind if we go into some of the questions that came up, like
Yeah,
in
absolutely.
my conversation with some other company? Like, here's a tough one for you. So this, I won't mention the name of the company, but they read one of my articles, and I was talking about, kind of implying, how it's useful for pain, or people have used it for getting off opioids and so forth.
Mm-hmm.
And this company, which sells tea bags, they said in their his email back to me, our position, since Kratom has not had any clinical double-blinded placebo-controlled studies regarding its efficacy for any medical conditions, is that our product is for general wellness and for the pleasant, uplifting effects. Any medical claims made by Kratom companies regarding their product's efficacy for conditions is unfair and risks taking advantage of desperate people without strong scientific evidence for their claims. We are, of course, aware that some people claim to have treated a condition with Kratom, but as a vendor who stands to profit from the sale of Kratom products, we ethically cannot make those claims until the rigorous scientific work has been published. And it's interesting because I see his point, but at the same time, I could argue that why hold off selling Kratom until you have the perfect, placebo double-controlled studies? There's plenty of evidence, both from anecdotes, and you'll have to tell me because I haven't deeply researched it yet, but there have been some studies. They're just not super, up to those standards, I guess.
Yes, absolutely. There's a lot in that message, so we can dive into a few aspects. However, what they're really trying to get to with double-blind placebo-controlled study, and that would be going through like a phase 3 clinical trial. That is the requirement for medical doctors to be able to prescribe Kratom for a condition. So that is a very specific set of rules that have to be met for doctors, which are licensed medical practitioners, to be able to fully recommend something. And to your point, just
very high bar.
Yes, but it also doesn't mean that people can't talk about their own personal experience. It doesn't mean that Kratom can't be promoted or people can't give information that they know in the research out there. And as an example, I have a friend who is an orthopedic surgeon. And so when he talks to his patients, he cannot legally recommend Kratom, but he can still also have conversations with them as a friend and tell about experiences of, well, other people have used Kratom, so if it works for you, yes, that's okay. But when we talk about a lot of the FDA messaging and what is allowed and not allowed, a lot of that does come down to if they are a licensed medical practitioner, and then what is the legal liability and that type of specificity of why some of that limitations are there.
Yeah, it kind of reminds me of, I remember a long time ago going to a doctor and I had some, musculoskeletal pain, and like offhand, he kind of shocked me. He said, "You mentioned cannabis, which wasn't legal at the time."
Yeah.
And I said, "Oh my God, my general practitioner just said cannabis."
Yes. And
It's kind of,
because you mentioned it before where you said, this kratom and this an area is more of like an art of understanding it. And that's also where a lot of fields, even medicine is, the practice and the art of medicine. And that's why we have doctors that will prescribe medications off label. So even though a medication is only recommended for one specific disease case or certain usage, doctors can, if in their judgment, working with their specific patient, do what they think is best. And that can be make recommendations that are off label, which means that it's not a fully approved specific reason that the FDA approved that medication for that specific condition. So that's where there's a lot of complication, and you kind of want that flexibility. I mean, we've already talked about how complicated everyone's body is. We all process things slightly different, and what works for us may not work for everybody else. And so I think that's where companies and people can still provide their own experiences, their information. But then, we don't make recommendations for other people, right? We don't take on, say, hey, this is going to work for you, or this is what you should do. And also, yes, people should always go to their medical professional, working with them to see if there's any special cases or needs
that's
they
what
have.
I was going to ask. Is like, it seems you have to take a very careful line in your marketing materials or what you recommend, and without making medical claims, but you're still wanting to recommend something or provide a service or a product. I'm glad I'm not a retailer.
Yeah, I think that was personally, that was some of the frustration that I ran into, where when I was first, consuming kratom, I would just get a bag from a vendor and there was absolutely no information about it. It would just say, sometimes not for human consumption, or this is a botanical specimen
sample,
only.
yeah.
It's like, okay, well, that's also not helpful, right? Like if you just have all these products out in the market and just people don't give any kind of information or some guidelines, that too is not going to be the best for society, the best for the overall public good.
Yeah, I would agree, and that's kind of the reason for the website. Is like, okay, so we don't really know, so let's find out.
Yes.
Let's research, provide information, and not just say, oh well, this is too gray area, can't deal with it, not sell it or anything.
Yes,
That
but
was kind of
to
for
your
my
point,
own information too.
But also, some of the comments in that response are also true, that there are vendors out there that are, say, maybe taking advantage of people in a desperate state. Absolutely. Sometimes we would see that where sometimes companies would maybe use like a fear of an import alert or some kind of restriction in supply just to try to get people to purchase quantities now. So, that's always, I think any industry, we have marketing practices from some companies or individuals that are not ethically, at least what I would consider doing.
Is more just to make as much money as fast as possible.
Yes, absolutely.
No matter how they do it. But then on the other end, there's those that seem very interested in what's true and what's ethical, and then kind of in between, companies that are doing their best to merge what's true and scientific as well as what's marketable.
Right. So. And that's an ever-evolving kind of a continual process.
It's complicated, man.
Yeah. Is there something surprising you found through your investigations, research? I know you mentioned kind of the white vein, some of the strains. Was there anything else that or maybe a better question is, do you have any techniques? So if you learn about something or hear about, a procedure or maybe like a tea, what is your process for, say, reading something online to then investigating whether or not it's accurate, or how do you go about determining that?
Critical thinking, I guess.
Yeah. Okay.
Experimentation. There's a lot more information now, but
Mm-hmm.
which is great. I mean, the internet has totally, opened things up. But I've always been good at research, so just find as much information as you can, and that's kind of the reason why I want to do this website, is try to pull as much information together as I can, using. And now we have these AI research tools, which are great. It can go out there and summarize information. Like I started to want to write about the history of Kratom, and I used Gemini Advanced, and it was able to consolidate a lot of different information, and it kind of helped me, make suggestions for information to put in an article. But yeah, it's kind of a general question, but
Yeah.
it's a research process. Yeah.
Excellent. Yeah. Can I ask about your background? You said you're a good researcher in general. Do you have do you have a career in any kind of applicable field that way, or just kind of like your personal passions?
I was self-employed am self-employed as a consultant
Okay.
for a long time, mainly in the computer field. So, but pretty much any kind of problem the client had, I would help with. I mean, one of my recent ones was helping someone write a book about the history of computers, and I edited the book. But I've built websites, I've done videos, photography, but a lot of writing. I
Wow.
mean, that's mainly, my degree was in philosophy and visual art, but it was like focusing on philosophy of mind, philosophy of science, as I was interested in how the mind works. But I got really good at research and just have always had extreme curiosity, I guess. So
Yeah, that drives a lot of it. That's amazing.
always writing about things, and so yeah, you take the boy out of the philosophy department, but not the philosophy out of the boy.
Yeah, I mean, philosophy is a very intriguing topic to me. Just kind of that, at least like some of my understanding of it, just the discussion of that deeper meaning in some ways, or how do we actually, even know anything, right?
Because how do we know anything, and
what exists, what doesn't exist? Yeah, all of it is a very fascinating
And by the way,
topic.
I find Kratom very helpful for writing in terms of sometimes kind of firing up the creativity.
Yeah.
Just stimulating the creativity. Although it's a double-edged sword, because although people find it helpful for ADD, supposedly, you can get so many ideas that you're not sure which to follow.
Yes. I think I've experienced.
Coffee is kind of like that too.
Yeah, I've experienced similar with Kratom. I mean, sometimes if a lot of times I'll use a small dose of Kratom tablets in the morning, and it kind of helps me work, do what I need to. But then sometimes if I take maybe like a mint, then it's really good if I want to say start cleaning the house and do something active.
Right.
But if I'm trying to force myself to sit in front of a computer at that time, I'm I kind of too much going. So it can be depending on what I want to do.
I know how that goes. Yeah, I feel I'm gonna get up and go. Do something, wash the car or whatever.
Yes, exactly.
Go for a bike ride. Yeah, it's kind of a balance. I mean, I think that's another useful thing for writing about it and letting people know. So one of the things I want to complete on the website is guidelines for how to use this, because it's I had to just learn by trial and error, basically. I don't think companies, as you said, since they can't always talk about it in detail, but to your company's credit, you do talk about how do you titrate a dose, how do you figure out what's the right level for you, and under certain circumstances, if you're doing an activity or something else, if you start to take too much, then you'll know. So you sort of start with a low dose and work your way up, right?
Yeah, I guess so. If I was a new Kratom consumer, or a new friend came to you, how would you recommend they start or be introduced to Kratom?
I would, just like you guys recommend, I would say, I don't remember the exact numbers, but I would start at a minimum dose, if it was leaf, a powder or something, 1 gram, and then see how you feel after 30, 45 minutes.
Okay. Yep.
And if you don't feel much, try another gram or something. It was kind of random when I started and didn't know. So but then you kind of work up a little tolerance, and then your dose goes up. But yeah, if you're just starting out, you definitely want to start low and then work your way up. And depends on what you want to do, like
right?
Athletic activity or focused study or whatever.
Yeah, absolutely. And I think to your point, the research. So it was kind of similar. We didn't have much formal research, but I think some of the surveys that have been performed by like Oliver Grundman, they were showing that on average people use anywhere from 1 to 5 grams. I mean, sometimes more than that, but 1 to 5 grams is a good general consumption amount. And to your point too, it's okay. Do I want a little bit of lift in my mood and energy, or am I looking for, like, I have my severe pain relief that I sometimes need from my degenerating disc in my lower back. So that also drives how much I consume.
Yeah, that's what I was going to say. It seems like and it depends again on your tolerance, but higher amounts generally are better for pain, whereas smaller amounts can be just more stimulating. Yes, and then depending on the type of kratom or the profile again.
And I think I've also heard Dr. Chris McCurdy out of the University of Florida, who has been studying kratom for many decades now. They often get samples that people will send in, and he tests, and they'll kind of give stories about why they use it. And he was saying that, it's not just the more potent mitragynine or the more potent of that alkaloid is not what people report as having the best benefits. And so it is much more complicated of some of those secondary alkaloids, even for pain relief. So yeah, that there's not really, I would not say it's true to your point that, higher consumption, higher potency is better. It kind of depends on the individual and really what, where does that pain come from and what are some of the complications around it.
Yeah, it definitely has been helpful with, I get lower back pain too, and it's been helpful with that and other little aches and pains we get as we go older too.
Yes.
But so that brings up a question that in my experience, I seem to, and I don't know if this has been so much true lately, but when you continue taking it, it seems like the anxiety reducing or the pain reducing qualities tend to taper off and the stimulating predominate more. In other words, the first time you take it, it's different in qualitative terms, like there's more of that warm flowing feeling than when you just keep taking it.
Okay, so to recap, I guess you're saying that when you first start taking kratom, there's more pain relief effect?
I'm not sure about the pain relief, but definitely that subjective sort of flowing, warm, glowing feeling.
Okay.
And I was assuming that's because of the different alkaloids. There's different tolerances to different kinds of alkaloids. So maybe the ones that are affecting the mu opioid receptors, there's more tolerance that builds up quickly with those.
That could be, yeah.
Compared to the more stimulating ones. That was my hypothesis.
Yeah, it's a great hypothesis. And I think some of the complications...
I'll drink to that.
Yeah. Actually, yeah, may I try some of your... I would love it.
Absolutely.
But yes, I think because Dr. McCurdy talks about, and I've also seen other researchers like Marilyn Hoistis that shows mitragynine is actually metabolized in human plasma into 7-hydroxymitragynine. And so that is a complicated layer to it, right? Because we know that 7-hydroxy has a very potent effect on the opioid receptor, the mu opioid receptor versus mitragynine itself. And McCurdy also talks about, well, there's also other metabolites from speciogenine, speciosialatin. So maybe as we, first consume it, our body has one effect, but then as we continually use kratom, maybe our body adapts slightly and metabolizes the alkaloids differently. So there could be a lot of complications.
Yeah, the body definitely adapts to things and metabolizes and generates enzymes that are breaking things down, and who knows.
Yep. Yeah, our human body is amazing how much it adapts in some of the best. It's a very... I say it's kind of some of the best and worst things about humans, that we're so adaptable. We can, take on a lot of stress or get accustomed to something. But then I think
even things that we shouldn't.
Exactly, right? And that's the downfall, I think. Yeah. So cheers, sir.
Cheers.
Thanks, sir.
Hope you like it.
Ooh, I like that. A little more like tangy from the lemon, and yeah, I really like
Yeah, I
that
use
flavor.
quite a bit of the lime powder.
Mm-hmm.
It's got turbinado sugar and a little bit of stevia powder in there. I didn't want it to be just straight sugar.
Yeah, no,
just
that's
to be
really great.
healthier.
I think we'll have to maybe consider getting some formulations from you and kind of see what we can do. This is great.
Yeah, absolutely. Maybe one of the ideas I came up with was maybe a Kratom coffee, because I often end up drinking coffee anyway, so why not combine them? And so I looked it up, and of course somebody's already marketed something like Kratom coffee shots, but
Yeah, I could see that.
there is a company down in San Marcos that has a whole facility where people roast and brand and market their own coffee.
Yep.
It's a California Roasting Company, I think
Okay.
it's called. And they're entrepreneurs like you. And I think someone could come in there and like create a Kratom coffee, maybe one that you grind with that already has Kratom. I don't know.
That'd be a really cool
It
experience.
started getting my creative juices
Yeah.
going.
Yeah, 'cause I mean, I've seen a lot of coffees with like mushroom extracts or mushrooms added for the health
Right.
benefits. And so, yeah, there's a
Mushroom
lot of good
powder.
ways to, and what I like about that is if you take I have a habit as well of drinking coffee in the morning. And so if I can add something to my habit where, instead of having to now take supplements or do something new, if I just
Or
change,
prepare two different things.
now it's one thing and I get all the benefits. I like that idea.
The drawback, of course, is caffeine and Kratom together. You have to be careful. It can get a little bit jittery or too
Yes.
stimulating. So you'd have to kind of warn people. So I don't know if that's a great product idea or not. But
Yeah, that's always, I mean, we struggle with that as well. I mean, we used to have a Kratom kava mint. So kava and Kratom combined together is a very common product. But we kind of found, well, okay, how, sometimes some people want a lot of kava and only a tiny bit of Kratom, or a lot of Kratom, less kava. So there's that kind of
yeah, you don't really have
now.
control over
Right.
the balance. Speaking of that, I did experiment with kava years ago, and I really enjoyed it on its own, but I found that combining it, like taking Kratom the next day or same time, it just something was off about it. It was like they didn't harmonize.
Okay. Yep.
But I noticed now it is often marketed, like there's all these little shops saying Kratom and kava.
Yeah, it's I personally too like kava, but just kava on its own from for me, like an alcohol replacement. I like using kava instead of drinking because I still kind of get this sociability, it's more talkative. I also like kava a lot from the muscle relaxant side. And so because of my degenerating disc, a lot of times my back will tighten up the muscles to protect it. And so I like playing golf, that I've gotten back into like the last, 6 months or so. And I found that kava is a really good complement to allowing me to keep my muscles from tightening up while I'm playing a round of golf.
Probably
more so.
a lot healthier than some of the pharmaceuticals they recommend for muscle relaxation.
Yeah, I did. So I have, I've been dealing with my chronic pain issue for a long time, and I did try muscle relaxants a long time ago. And I remember it did not really help any noticeable benefit to my pain, but it gave me some night sweats where I was just sweating like profusely in the middle of the night. And so it wasn't helpful for the pain, didn't really give the benefit I needed. And then some of the side effects were also then not good. So unfortunately, it did not work for me specifically.
Yeah, it seems to me like kava and kratom are almost opposite in the sense of kava is something you take for relaxation, like totally chill out in the evening, whereas kratom is, and this is reflected in how it's used in Indonesia, right? Like the workers
Day
take it
laborers,
and go
yes.
out and work in the field, and it helps them to keep going. So it's more about being active rather than inactive.
Yeah.
So there's kind of like maybe that accounts on a subjectively, at least, for the clash.
I can see that. Yeah. There's that mix of, and it definitely interacts with different receptors. So yeah, kratom mainly on kind of the mu opioid, kappa opioid, the serotonin, some of the dopaminergic system, and the alpha adrenergic receptors. But then kava interacts with the NMDA receptor, which is similar to alcohol ethanol, works with the GABA receptor, and then it's also like a calcium and like a potassium blocker for like that
makes
muscle
sense, 'cause
relaxation.
some of the muscle relaxant medicines that you pharmaceuticals are GABA.
Yes, exactly.
Okay.
Yeah. So do you have what other questions, or if we have?
Oh yeah.
Upcoming
So
surgery.
I mean, this is a question that came up for me. I am due to have a surgery in August, and I thought, they may want to give me narcotics for pain, and I thought I would rather not do that. I don't want to take, oxycodone or whatever it is
Sure.
they use. But I don't think I mean, my experiences at healthcare providers, even alternative ones, they've never heard of Kratom. And as you said, apparently it's not, it has to go through all those approval processes. So I feel like I probably even no point even bringing it up and saying, can I take it after the surgery?
So as we discussed earlier, definitely medical professionals cannot officially recommend Kratom. But I would say that, you are the patient. It's your body. You have autonomy over what you choose to do. And so, yes, even though a doctor doesn't recommend it, you can tell the doctor what you want to do. One of my friends...
Well, I'm wondering if, can I even, bring it into the hospital? And they're probably not going to say, do what you want. I don't know.
There's no laws against it, so they should not be able to stop you. I would, talk to them about it, inform them. It's always best to be fully transparent with your medical professionals, because there can be interactions, or if they do give an opioid, make sure that there can be contraindications. So, if you take an opioid with Kratom, that will have compounding effects.
Yeah, but they probably won't know.
They won't know. Yes, they won't know, say, the official how much that's going to affect you, but at least if they're aware of it, they can, adjust or be more cautious. One of my friends...
It'll be interesting to see what they say.
Yeah.
I'll let you know.
You might have to educate them. I find that sometimes I talk to doctors, they've heard about Kratom, but they don't really know much about it. Other doctors I've talked to have no idea, and I end up educating them as much as possible, just to kind of keep.
My other question was
going.
how do I introduce it or talk about it to not just friends and family, but to a doctor? What would I say to a healthcare provider about Kratom? How would I describe it?
I generally talk about my experience with it as far as why I use it for my back pain. And I do then talk to doctors about the mu opioid, because doctors are very familiar with, or some are more familiar with, the pharmacokinetic activities, and the mechanism of action is really what doctors like to get into, is why or how something is working.
Sure.
So I generally do go to the, what receptors it interacts with, as far as even going down to, okay, yes, this interacts with a mu opioid receptor, but it also interacts with serotonin and dopamine receptors as well.
And it shows you have some technical understanding and rationale behind using it, not just some random, I want to take this weird drug.
Yeah, exactly. And then I generally also find it's helpful to inform the doctors that mitragynine is a partial opioid agonist, so it does not fully bind, and it's also a G protein agonist, which is different from opioids.
And it doesn't, didn't mean to interrupt, but it doesn't repress respiration. That's very important point, right? Exactly.
So that's a major difference.
Yeah, which makes it safer than your traditional opioids.
Right. And I find doctors, they're receptive, and maybe a little bit of that information sticks with them, but I also find they're so busy, they're kind of ready to get out of there and move on. But
it occurs to me they probably would be very wary of it because it interacts with opioids. They would say, well, we don't know what's going to happen. They're probably going to say, I cannot recommend this.
Yes, absolutely. And doctors are very much about liability. You have to look at it from their standpoint, that they're very responsible. So if they make any kind of recommendation, they can get malpractice lawsuits. There's all sorts of, they're taking on a lot of risk just doing their profession. And so I mean, from their standpoint, they only see a patient for 7.5 minutes on average.
So I'll tell
now,
them,
and
I'm not going to blame you if
yeah.
anything happens if I take my herbs.
Right. I mean, I also find it too where, kind of like back to my friend who he cannot officially recommend something as a medical practitioner, but he can, you can still ask your doctor of like, hey, I know, like, okay, if you're not my doctor right now, what would you recommend as a friend, knowing that this is not official medical advice? Sometimes that can help get more information without kind of them feeling at risk for liability or, because there is kind of that notion of
That's
like,
a good opener
if it's risky,
there.
I'm just going to say nothing.
Mm-hmm. Great. Yeah. Okay.
But I definitely have Danny Way, one of my friends who's a professional skateboarder. He jumped the Great Wall of China, jumped out of a helicopter. He's had 28 orthopedic surgeries, and he has a couple more scheduled. He actually has chosen not to use opioids because he did get addicted to some of them in the past because they were just giving so much at that time. And so he informs his doctor of, hey, I'm not going to take that opioid. I just have this Kratom that I'm using, and they're okay with it. So, I mean, the patient always has, I am my own patient. I can do what I want and tell my doctor what I'm looking for or not.
Exactly. Do you have any experience or recommendations about it's good to take a break sometimes, like if you really develop a habit and you feel like you're just kind of taking it to get rid of withdrawals or because it's a habit. What would you recommend for how someone should take a break from Kratom if they feel that would be a healthy decision? Like a step down. What I did in the past was step down very gradually. And I think probably different people have to do it differently, like do it
absolutely.
Extremely gradually or cold turkey or
it's and to your point, taking a break from any substance. Even I would say, for me, intermittent fasting or doing like a 48-hour fast, literally taking a break from food and letting my body reset and figure things out is also, we know that's healthy. That fasting can be very helpful. And so I think to your point, any kind of substance that we're using on a regular basis is a good idea to evaluate and maybe take a break if that's appropriate.
Because like you were saying before, you've adapted to it, but adaptation is not necessarily a great thing. It's kind of like you're forcing your body to
sometimes
go out of
alignment or balance, and it's
homeostasis.
And so to your point, everyone is different. I know there's times where I'll stop taking Kratom just cold turkey. The next day I stop, and kind of because I'm traveling or resting, taking a break just in general, and I don't have any kind of urge or need to, and I kind of forget about it. And I've done that for several weeks or month, and I don't really notice any difference. But I would say if I am consuming, say, a high amount of Kratom, especially extracts, that then I do taper for the next couple days. I found that if I'm taking high potency extracts and want to taper or stop, then I end up switching to whole leaf Kratom and then reducing my amount over the next 2 to 3 days. So I think that is kind of what I would recommend is, switching, if you're using an extract or something that's potent, switch to a whole leaf version of Kratom and then reduce that amount over the next day or couple days.
You're drinking a tea, you could just measure the amount and
absolutely. Yep.
take less. I guess that the pills would be very convenient for that too. You could just take a certain number of pills and then go down on the amount.
Yeah, absolutely. That was one of the main reasons we originally created the tablets, was because scooping a tablespoon or a teaspoon, how much am I taking? And it was a convenience on, I can measure out one tablet, 300 milligrams. I have that consistency and amount that I'm taking.
Very easy, I would love to visit your greenhouse if you're still growing Kratom trees.
Absolutely.
Take some photos.
Yeah, we moved up to Fallbrook, California. So we have a greenhouse up there, and the plants are stabilizing. So we moved them probably about 6 months ago, and now it's the nice warm, hot summer, and at least especially in the greenhouse. So we can keep them covered, keep that humidity up high, keep that temperature up higher. So they're starting to get reacclimated and really have a nice vibrant growth to
Do
them.
they need that heat and humidity to have potency?
That's a good question. So I think there definitely seems to be potency differences based on the genetics. So we have done cloning of certain varieties, and we see that certain varieties have a much more potent alkaloid test, even at a new plant, just off the new cuttings.
You have to give me some of those cuttings.
Yeah, for sure. Yeah, happy to. And but I think there is also, as an example, it's like during the rainy season in Indonesia, because the plants are able to grow much more quickly with all that water, they kind of flush out a lot of leaves. That seems to slightly reduce the amount of mitragynine concentrate in the leaf. And that's very similar to if people are wine drinkers. Generally, if there is, say, a poor year or a bad year for weather, then the amount of grapes that are produced are much lower in volume. But because the plants are struggling during this time to really produce that fruit, it kind of concentrates all the flavors and creates this, great tasting wine at the reduction of the volume amount of grapes that are produced.
And sometimes some plants, like the older leaves, will have higher concentrations of
So that was
alkaloids.
Dr. McCurdy hired an intern from Thailand a couple years ago, and the intern, she was saying that, well, traditionally in Thailand, when people are going to pick a leaf out in the jungle or on the farm, they would look for about 3 nodes back or older.
Oh.
And Dr. McCurdy was like, well, okay, I know that's interesting. I mean, let's test it, because that is the amazing thing about traditions, is that they generally develop out of a reason, or it's kind of long-term trial and error, long-term experimentation. And Dr. McCurdy did find that, yes, one of the alkaloids, I think it was maybe speciogenine, that gets produced in the plant leaf first, and then is converted into mitragynine. So that slightly older leaf, 3 nodes back, had higher mitragynine levels. And in fact, over the last 10 years or so, Dr. McCurdy has been saying that because they kind of test industry samples in general, they've seen a slight reduction in mitragynine and then a slight elevation in that speciogenine, meaning that essentially what that is
they're
showing,
newer leaves that they're harvesting.
yes, because essentially as kratom gets more popular, the demand is growing.
Sense.
They're just picking all the leaves they can versus waiting to pick the
So they'll advertise,
a little bit older.
They found these old growth trees deep in the jungle, and that's where our product is.
Yes, exactly. Yep, there is that type of marketing that has come into play for that.
Can we switch to another sort of pharmacokinetic question? Because in my experience, I found after I drink Kratom, half an hour, 45 minutes, my appetite will really come up. Plus, the food tastes better. But I'm thinking there's like a blood sugar effect. And I did some research, and I did find that it said there is an inhibition of alpha glucosidase and pancreatic lipase. So there's some traditional use for diabetic conditions, I think, but that may account for why you get suddenly so hungry. I don't know if that's universal though, but that's my experience.
Yes, I think there could be a couple interactions. So one might be I think part of the adrenaline or the dopamine side will kind of suppress the digestive system. And so people do talk about kratom consumption reducing appetite or kind of that hunger feeling. But now what you mentioned was there is a study that I also came across a couple years ago that was a mouse or a rat study. And this was looking at kratom tea, so full spectrum kratom extract, and also mitragynine, and how it impacts 2 enzymes. So that alpha glucosidase is an enzyme that allows our body to break down complex carbohydrates and also allows our intestines to absorb glucose. So if we inhibit that enzyme, then our body just simply can't process some of the food to extract the glucose. And so, yes, it does kind of help stabilize or lower blood sugar. And then
I noticed that when I gave it to a friend once too, that what was it? They suddenly felt very hungry, but also then energized later. But they did feel that like typical blood sugar lowering.
Yes. Yeah, we had one of our employees at the greenhouse was having some difficulties with blood sugar control. And, I informed her of, hey, this is some of the research that's showing, maybe, talk to your doctor, see if you want to add this to it. And she was able to add Kratom in with her other medications and was able to stabilize her blood sugar in a very healthy way.
Oh, interesting. Are there any immune system boosting properties that are established for Kratom? Or is it pretty anecdotal?
Yeah, I mean, I think it seems to be all anecdotal. And I think part of that complexity is the immune system in itself is very complicated.
That's
and all
true.
the autoimmune issues we're
too.
going through. Yeah, it's a very interesting topic. I mean, I did come across some research many years ago with this hypothesis that essentially plants produce, I want to say, lectins that are kind of a class of compounds that are basically like a defense mechanism against funguses or pests or like bugs, insects. And some of the thought is that humans, when we consume these plants, then our body, our immune system can then use these compounds that essentially were originated to help defend the plant against insects.
Defending us against the bugs that are out there.
Yep.
I mean, again, this is purely anecdotal, but when I started drinking Kratom again, I generally don't get sick much, but I haven't gotten sick at all for a couple of years. But who knows? That's just me.
And I would say, too, there's probably also a factor of, like myself, if I'm willing to consume Kratom and go down this path, I've probably done a lot of research. I'm probably more health conscious in general. And so I think part of a good immune system and not being sick is also drinking water, eating whole foods, eating a proper nutrition, and exercising. So there could be kind of a self-selecting bias
low
towards
stress.
that.
I think that is probably one of the biggest factors in staying, keeping the bugs away is just
absolutely
lowers your stress level.
Yes.
And in diseases in general. And so I tend to monitor that. I'm a big promoter of preventative medicine. And the mental factor, like I said, your mental state affects your stress level, and then your stress level keeps a low stress is just healthier in general. I don't think stress is ever really that healthy, in my opinion.
Yeah, I would say it's a small amount of stress is actually required for our bodies. And so an example would be when an astronaut or someone goes to outer space in zero gravity, there is essentially no more stress on our bones because there's no gravity. And what happens is the bone density starts to reduce or lessen.
Well, that's physical stress.
Yes.
I mean, like emotional stress.
Yeah. So in kind of the too much stress, too much mental. And I think too what helps.
I mean, although activation and alertness is good.
Yeah, it's right. Everything's, I think, a balance. But yeah, to your point, too much stress, I think, is underappreciated for how much it can cause pain, sickness, diseases. There's a lot more to that. Thank you for tuning in and gaining more insight into Kratom and listening to our guest, Eric Platt, and his experience and history of how he found Kratom, enjoyed it, and all these wonderful questions. If you found today's episode valuable, learned anything, or just enjoyed listening, we'd really appreciate it if you support the channel by shopping at ETHANaturals.com for all of your Kratom needs. Also, don't forget to follow us on social media at ETHANaturals. Your support and your dedication, your questions really mean a lot to us, so we really appreciate it. Today's topic was brought to us by you guys. One of our customers came in, and we're so happy and fortunate that you made time to do this, so really appreciate it, Eric.
Thank you.
If you have anything you'd like us to cover in future episodes, please submit your questions in the comments or the Q&A section down below, or reach out to us on social media, or you can send us an email, podcast@ETHANaturals.com. Until next time, I'm Alexander.
And I'm Eric.
And I'm Baltazar.
And I'm Nicole.
And as always, live fully.